Schizophrenia is a mental disorder that causes symptoms such as hallucinations, delusions, lack of motivation, and disorganized thinking. Here we have a teenager named Dave. Recently, his grades have been dropping, and he often feels isolated. Dave has also had trouble sleeping recently and has experienced hallucinations while awake. These are all potential symptoms of schizophrenia that are often seen in teenagers and raise an important question. What is causing all these symptoms? Let's take a closer look.
During neurotransmission, the electrical impulse travels down the presynaptic cell, causing neurotransmitters to be released into the synaptic cleft, after which they bind to receptors passing the signal on. The neurotransmitters are then reuptaken back into the neuron. Research indicates that schizophrenia is related to the neurotransmitter dopamine. Let's investigate the structure and function of dopamine and why it's important in examining teeth.
Dopamine plays an important role in human behavior and cognition. In humans, there are two main types of dopamine receptors. Type 1 increases production of the secondary messenger cAMP, and type 2 inhibits production of the messenger.
The binding of the dopamine to the specific G protein called the dopamine receptor causes production of cAMP, which helps transmit the signal in the neuron. Let's see how this can help treat schizophrenia.
Some symptoms can be caused by an imbalance in the amount of certain dopamine receptors, namely D1 and D2. This results in an imbalance in the production of a secondary messenger, which changes the way that the nerve signals are transmitted.
Treatment is often lifelong and consists of a combination of medications and therapies. Common medications include antipsychotics, many of which are dopamine antagonists targeting D2 receptors. Typical antipsychotics bind to dopamine receptors without activating them. Atypical antipsychotics inhibit both D receptors and serotonin 5-HT receptors, but have a stronger affinity for serotonin receptors. Serotonin is unable to bind to the receptors and acts as a natural competitive inhibitor of dopamine, decreasing its presence. Common therapies include cognitive therapy and behavioral therapy.
Here we can see the structure of the D2 receptor bound to the typical antagonist antipsychotic heripital due to interpecular forces. With proper treatment, Dave was able to reduce the symptoms. All schizophrenia is estimated to occur with less than 1% of the global population. 40% of schizophrenic patients still go untreated. This is why it's crucial to diagnose schizophrenia as early as possible so that adverse long-term implications do not occur.